Good evening, Madam Chairwoman and members of the committee. My name is Autumn Leva, and I am here representing Minnesota Family Council this evening. I think it's first instructive to look to Colorado, who first began using medical marijuana in 2001. And the medical marijuana registration program indicates that from 2001 to 2013, 94% of the reporting conditions for use of medical marijuana were for severe pain, not cancer, glaucoma, or AIDS. Other authorized conditions weren't even close, with muscle spasms coming in at a distant second place at 13%. So I think it's instructive to point out that if those statistics carry over to Minnesota, if this bill were to become law, Minnesota legislators would be authorizing for users overwhelmingly claiming severe pain the use of a highly addictive and unproven drug. And at the very least, this should cause pause for some serious concern. And that's why I'm here tonight, to point out 5 main concerns that we have with this bill. I will be succinct. The first is that marijuana is, as a gentle reminder, still illegal under federal law. Secondly, this bill is being sold as a help for the very sick and terminally ill patients, but many of the medical communities this bill is said to help don't even support the use of medical marijuana. To list just a few: American Cancer Society, Multiple Sclerosis Society, and the Tourette Syndrome Association Medical Advisory Board finds that studies are inconclusive to show positive effects of medical marijuana on Tourette's, and emphasizes the high degree of risks associated with the drug and the long-term effects.
No, do you represent any of those organizations?
No, ma'am. This is research found right on their website.
Giving us a survey of websites.
Correct.
Okay.
And their position on the issue, yes. And finally, American Medical Association and American Academy of Pediatrics. The third point is this is still a highly addictive, mind-altering drug that the government has classified as having, quote, no medicinal uses and high risk for abuse. The list of risks associated with marijuana, according to the National Institute on Drug Abuse, is quite long, including mental health problems, lung disease, heart attack, harming brain development, and the list goes on. In fact, again, the NIDA states clinical evidence has not shown that the therapeutic benefits of marijuana outweigh its significant health risks. Point number 4, this authorization of medical marijuana makes a mockery of the drug approval and use process. So when we're prescribed an FDA-approved strong drug by a doctor, I think all of us have been there at some point, the container specifies the use of the drug, exactly how many to take and when, restrictions on refills, side effects, interaction with other drugs, how long to take it, warnings, etc. There's no warnings for the aforementioned serious health risks associated with marijuana on a marijuana plant. No warnings on a joint that it contains 4 times the amount of carbon monoxide and tar as a typical cigarette. And a patient's authorized 12 marijuana plants don't mention that marijuana is highly addictive. In fact, 4.5 million addicted in the U.S. today, and that its potency has risen steadily since the 80s. And that the FDA has approved THC as a medication, but it has not approved the marijuana plant because insufficient clinical trials to show that its benefits outweigh the risks. And to be considered a legitimate medicine, a substance must have well-defined and measurable ingredients that are consistent from one unit, such as a pill, to the next. And this consistency allows doctors to determine the dose and frequency. Obviously, a marijuana plant is different from that. And again, the significant health risks prevent it from being FDA authorized. And finally, and perhaps most importantly, this bill sends entirely the wrong message to our youth. According to the NIDA, quote, rising marijuana use reflects changing perceptions and attitudes. Historically, as perception of risks goes down, use goes up, and vice versa. Young people are showing less disapproval of marijuana use and decreased perception that marijuana is dangerous. The growing perception of marijuana as a safe drug may reflect recent public discussions over, quote, medical marijuana, and movements to legalize the drug for adult recreational use in some states. They also note that marijuana use by adolescents declined from the 90s till mid-2000s, but general use and daily use have increased since that time. So, you know, for marijuana for young people, which we know comes with significant risks, including a higher increased level of school dropout, this is a serious concern and a serious cause for concern in sending a message to our youth. So in conclusion, For a highly addictive drug with well-documented health risks as well as societal risks, including increases in crime, likelihood of school dropout and/or career failure, poorer mental and physical health, and in relationship and bonding issues, and with leading associations representing those who suffer from the, quote, debilitating medical conditions listed in the bill, warning that the risks of marijuana use are outweighing any potential, though as of yet clinically unproven benefits, this committee ought to have serious pause before putting at risk the entire state, especially our youth, for a dangerous drug that the overwhelming majority of people would likely use for serious pain. So we at Minnesota Family Council urge the Health and Human Services Committee, a committee designed to be a legislative watchdog creating policies to benefit the health and well-being of the individuals and families in our state, to vote against passing this bill out of committee. Thank you.
All right, thank you, Ms. Leva. And I just want to invite you, if you're worried about highly addictive drugs with well-documented health risks, to stick around and hear our next bill and the lengths that we have to go to deal with the drugs that are available, which are being used to treat chronic, serious pain.
I'd be happy to. Thank you.
Okay.